Welcome, everyone. As I mentioned a couple moments ago, I am Bruce Cowan, the Executive Director of the Tri-State Chapter of the Scleroderma Foundation. And today we have this set up as a webinar style. I'm going to give a little bit of a background on our program today and our speakers. So we don't have to worry about muting anyone or turning off your video because it's in a webinar style, which you normally need to do. You may see on the bottom a Q&A spot, and you will see a chat. We're going to use the chat box today. If you have any questions, please type them in the chat box to everyone. Elizabeth Soto Cardona, who's a manager of the SVM Center at HSS, who organized all the logistics for today, and she's smiling because it's working well. Don't jinx us. And I will present your questions to the speakers at the end of the full presentation. So today's webinar is being recorded by HSS and will be available on the HSS SVM website probably in about 2 weeks after they have to vet through it all. And a couple of days, the PowerPoint of today's presentation will be emailed to everyone, because as you signed in, you had to give us your email. So if there's any questions, the flyer has Elizabeth's email on it. HSS, Paul, is Hospital for Special Surgery. I'm sorry I said it wrong, HSS. So today's webinar, as I said, is being recorded, but for HIPAA privacy considerations, the question and answer portion will not be recorded or available to the program to keep everybody's questions, on a privacy level. So most of the questions are better if you ask a generalized question more so than I have this own particular problem, because it's difficult for the doctor and the social workers to speak to you when they don't really know you. A lot of those questions really need to be related to your own physician, your own medical team. So we would appreciate at the end of the program, there's a short evaluation. There's a link that Elizabeth put up there. We're going to put it up on the screen also. In the past, it's been about 10 questions, and you can really answer them rather quickly. That will help put together programs for the future. This is actually the 5th program that we put together in maybe the last 16 or 18 months, and we're very appreciative at Scleroderma Foundation for the HSS team that's here today, and a couple of other doctors that have participated in the past. For those attending today who are not familiar with us, the Tri-State Chapter of Scleroderma Foundation, we serve New York State, Connecticut, and Northern Jersey, where we've been active for 40 years. This is our 40th anniversary. We're part of the National Scleroderma Foundation based out of Boston. And our mission is support, education, and research. If you'd like more information on us, you can go to our website, sclerodermatristate.org. That's sclerodermatristate.org. We also put that up in the chat box also. And the Scleroderma Tri-State Chapter and the HSS Scleroderma Vasculitis and Myositis Center have a very long history of collaboration together. And for more information on HSS, on background, Elizabeth put the website up there. You can actually Google HSS SVM, it'll pop right up to you also. As I said, this is the 5th in our series, and today's program will feature Dr. Kimberly Showalter speaking on approval of two new medications for the treatment of ILD, and I'll let her go into all the details stuff. Dr. Kimberly Showalter is assistant attending physician at HSS, specializing in the care of patients with various rheumatological conditions, including systemic sclerosis, systemic scleroderma. She graduated from University of Virginia with a BS and medical school at Georgetown, where she graduated cum laude. She completed her residency training in internal medicine at Northwestern University, that's in Chicago, and her rheumatology fellowship training right here at HSS. Additionally, she received an MS in clinical and translational research from Weill Cornell Medicine. Currently, Dr. Showalter conducts clinical and translational research in systemic sclerosis with a focus on testing novel therapies. She received funding and recognition for her research, including the Rheumatology Research Foundation Resident Research Preceptorship Award. Boy, that's a big one. And the Scleroderma Foundation New Investigator Grant. Kim was awarded in 2021 with the Scleroderma Foundation, along with seven other research colleagues around the nation. And, we're pleased that some of our efforts with our walk, which I'll talk about at the end of the presentation, raised funds that help to, in part, support her program. Following Dr. Schoenwalter, we hear from Julia Kleiman and Susan Rodriguez, who are the social work department attached to the rheumatology department, HSS. And Julia Kleiman and Susan Rodriguez have been instrumental in putting this whole program together. So they're going to speak to the strategies to optimize patient access to these two approved medications. As I said earlier, you have the ability to put questions in the chat. Please put them to everyone. Elizabeth and I will monitor it. We usually try to combine like questions and work that way. So I need to read a little statement, and then we're going to get going. The Hospital for Special Surgery and the Scleroderma Foundation in no way endorse any drugs, treatments, clinical trials, or studies referenced in today's webinar. The information is provided to keep the listeners informed because the manifestations and severity of scleroderma vary among individuals. Personalized medical management is essential. Therefore, it is strongly recommended that all drugs and treatments be discussed with the individual's physician for proper evaluation and treatment. Today's webinar is for educational purposes only. And we're going to start our program. Welcome, Dr. Schoenwalter.
Thanks so much, Bruce. Let's see. All right, can everyone see my screen? Okay. So good afternoon, everyone. My name is Kim Schoenwalter, one of the rheumatologists at Hospital for Special Surgery in New York City. Thank you so much for joining us during your lunch break to learn more about treatments for scleroderma lung involvement. I'd also like to thank the organizers of the event, including those here at HSS, Elizabeth, Juliet, and Susan, and our partners at the Scleroderma Foundation, Bruce Cowan and Candace Snyder. Today, I'll be discussing scleroderma lung involvement and two medications which were approved relatively recently for the treatment of scleroderma in the lungs. And these are the first two FDA-approved treatments for manifestation of scleroderma. So it's an exciting topic for us. I have no relevant disclosures, which means I have no relationship, financial or otherwise, with either of the medications that we're discussing today. So today I'll review in brief scleroderma involvement in the lungs, which is also called interstitial lung disease. I will also focus on two FDA-approved medications for scleroderma ILD. The first to be approved is nintedanib, which is also called Ofev, which was approved in September 2019. And then next, I'll discuss tocilizumab, which is also called Actemra, that was approved just a few months ago in March 2021. Both of these medications are specifically approved for interstitial lung disease and are not meant for those who don't have scleroderma in the lungs. Both medications, I will discuss the way the medications work, the expected benefits, and also the associated risks. At the end of the presentation, I'll introduce our next speakers, as Bruce mentioned, and please do enter those questions in the chat, and we'll make sure to get to as many as possible at the end of our session. Scleroderma is relatively rare, and the systemic form impacts about 100,000 individuals in the United States. Of those, about half have lung involvement in the form of interstitial lung disease. The symptoms of interstitial lung disease include cough that's often dry, meaning not productive of sputum, and shortness of breath that is particularly worse with activity, as well as fatigue. And if you have any of those symptoms, it's really important to discuss with your doctor. Tests to determine if interstitial lung disease is present include imaging, like X-ray shown in the bottom image, or CT scan, which is shown in the top image. Our current practice guidelines really emphasize the early detection and prompt treatment of interstitial lung disease for patients with scleroderma. And therefore, your doctor will often check the lung function over time and the imaging tests at baseline, even if you don't have symptoms, in order to find any early, even asymptomatic types of lung involvement. And part of the reason to detect interstitial lung disease early is that we want to have as many individuals as possible treated in order to maintain lung function over time. And there are several recognized patterns of lung changes with patients with scleroderma. And this graph is from a study that included over 800 patients and looked at their lung function over time. So the x-axis is years from 0 to 5, and the y-axis is lung function. And so the higher on the y-axis, the better the lung function, the lower it is, the worse the lung function. And in this study, about 12% had improvement over time, 15% were pretty stable. About half experienced overall decline, but had some periods of stability and some periods of decline. And then about a quarter of the individuals studied had a more severe decline in lung function. And really our goals are to start the treatment as early as we can to get as many people in these green and yellow lines of stability and improvement over time. And over the decades in the past, two really important studies are worth mentioning. So in 2006 and 2016, that really shaped our practice for management of lung involvement in scleroderma. And these studies were the Scleroderma Lung Study 1 in 2006, and then 10 years later, the second Scleroderma Lung Study in 2016. And these medications were studied included mycophenolate and cyclophosphamide. And in the first trial in 2006, cyclophosphamide was better than a placebo pill. And in the second trial in 2016, mycophenolate or CellCept was similar to cyclophosphamide. More patients were able to stay on CellCept, and since then it really has become a cornerstone in the treatment of scleroderma in the lungs. And then in 2019, in June, this study was published in New England Journal of Medicine, which is a premier scientific journal. And the study was for nintedanib in individuals with scleroderma in the lungs. And the results of the, also called the Census trial, led to the FDA approving the first medications for treatment with scleroderma in the lungs in September of 2018. So nintedanib, or Ofev, who is it approved for? So there are three populations or groups that Ofev is approved for. One are individuals with idiopathic pulmonary fibrosis. Two are individuals with chronic interstitial lung disease that's worsening over time or progressive. And three are individuals with scleroderma associated interstitial lung disease. How does it work? It is a type of medicine called antifibrotic. It specifically is a tyrosine kinase inhibitor. What it does is it impairs the ability of fibroblasts, which are important cells in scar and fibrosis formation in the skin and the lungs, from activating and moving around and increasing in number. It inhibits these important pathways involved in lung fibrosis, which is a component of interstitial lung disease. And the medication has been shown to reduce the decline in lung function or promote lung stability. How does one take Ofev? So Ofev is a pill. It's taken twice per day with food, meant to be swallowed whole, not crushed or chewed. If you miss a dose, you take your next dose as scheduled, and it should be stored at room temperature, which makes it convenient for those who are traveling. Like all of our medications, there are side effects. The most significant side effect or common side effect was diarrhea. So in the chart you can see in the trial, 76% or a large majority of individuals experienced some degree of diarrhea. Most was mild or moderate in intensity. Most often occurred in the first 3 months. In about 20% of patients, dose reduction alone was able to resolve these symptoms. Only 7% did have to stop though. Your doctor might give you a medication that can decrease diarrhea, which can be helpful. Nausea and vomiting is also possible, but most patients were able to tolerate it with medications or improved tolerance to the medication over time. And only 1% in the trial had to stop specifically due to nausea and vomiting. Weight loss and decreased appetite are possible, as are changes in your liver numbers. Most of the liver enzyme changes that we saw in the labs, they're reversible if we'd reduce the dose or stop therapy for a brief period, and most of the cases were mild. The risk of liver issues might be higher in women who are of low weight, and your doctor will be monitoring for this. Strokes and heart problems, they were not seen at an increased risk compared to the placebo in the scleroderma trial, but there were some events in other studies, so your doctor will be monitoring for that as well. Similarly, tears in the esophagus or stomach, it wasn't seen in the scleroderma study, but less than 1% in the study that was looking at patients with idiopathic pulmonary fibrosis were noted to have this problem. And so you should definitely let your doctor know if you've had that as a history or had recent abdominal surgery. One of the kind of important positive things about OFEV is that there's not an associated increased risk of infection, so it can be combined with other medications in scleroderma. So I'd like to talk about pregnancy concerns. So it's not known if OFEV can cause birth defects or death to an unborn baby, and it's not known if it passes into the breast milk. It's recommended not to get pregnant while taking OFEV, and that to take a pregnancy test prior to starting. If you're able to become pregnant, your doctor will recommend an effective birth control option during treatment and for at least 3 months after treatment. And it's important to remember that oral pills like birth control pills might not work well if you've been experiencing vomiting. If you become pregnant or think you're pregnant while you're taking OFEV, definitely let your doctor know, and it's recommended not to breastfeed while you're taking OFEV. So there have to be benefits, or else why would we prescribe this in light of some of the side effects? So OFEV has been studied in 5 randomized control trials that are blinded, placebo controlled, and basically that just means kind of the gold standard of testing in a clinical trial. And about 2,500 patients have been included in these overall. The Census trial is the largest phase 3, which means sort of late kind of phase testing effectiveness in patients that are intended to receive the medication in systemic sclerosis, and 580 patients were included. They looked at lung function from the beginning of the trial to 1 year later, and they found that the people who were taking the medication had less decline in lung function than the people who were not. And so on the graph, you can see the dotted line is no change at all in lung function. Below the dotted line is a reduced lung function, and above would be improvement. So you can see that the nintedanib group did have a worsening lung function over time, but it wasn't quite so much as the placebo group, who did worsen more than that. And this difference is small, but significant. And they have done studies looking at subgroups based on taking CellCept or mycophenolate, which should suggest that the combination of these two might even be better. So what should you tell your doctor before taking nintedanib? So you should definitely let them know if you have liver problems, if you have heart problems, if you have a blood clot or bleeding issue in the past. If you're a smoker, it's truly recommended that you stop, not just for lung disease, but also because smoking was associated with a decreased exposure in the body of the medication. So for 2 reasons, smoking cessation is really important. You should let your doctor know if you've had recent abdominal surgery, if you're pregnant or breastfeeding, and then definitely what medications you're taking, including the ones that are over the counter or supplements. For example, St. John wort decreases the effectiveness of OFEV. And then there's some antifungals and antibiotics that can impact the metabolism of the medication to either increase its amount in the blood or decrease the amount in the blood. So it's really important to make sure you tell your doctor about everything you're taking. So next, I'd like to talk about tocilizumab, which is also called Actemra. And this study was called the FOCUS trial, tocilizumab in systemic sclerosis, and included patients with scleroderma who had and did not have interstitial lung disease, and was published in August 2020. And then just in March of 2021, it was approved for the use specifically of interstitial lung disease and systemic sclerosis. So who overall is Actemra approved for? So moderate to severe rheumatoid arthritis, giant cell arteritis, which is a type of vasculitis, active polyarticular juvenile idiopathic arthritis, and systemic JIA, which is a type of inflammatory arthritis in children. CAR T-cell induced cytokine release syndrome, which is an issue in oncology. And then, of course, slowing the rate of decline in pulmonary function in scleroderma lung involvement or interstitial lung disease. How does it work? So tocilizumab is a biologic, which means it's a medication that uses the pathways that your body uses in order to change the immune system. And specifically, it blocks something called interleukin-6 receptor. It's been shown to reduce the decline in lung function in patients with scleroderma and interstitial lung disease. How do I take tocilizumab? So tocilizumab is an injection under the skin, or that's called subcutaneous, and it can be done in the abdomen, upper thighs, or in the back of your arms. It's a protein, so if you took it by mouth, it wouldn't survive through the stomach, and that's why it's injected. You should definitely receive some type of training prior to injection with your healthcare provider, who will answer all of your questions prior to your first injection. But then subsequent injections can be done easily at home. The medication can be stored in the refrigerator, but shouldn't be frozen. And it's recommended that you would remove one of the syringes about 30 minutes before injection, and then don't warm it or put it in the microwave or direct sunlight for the best results. And it's given once per week. So tocilizumab, like all of our medications, also has side effects. And some of the main side effects are infections. So tocilizumab changes the immune system. In scleroderma, the immune system is overactive, and so this medication can help calm the immune system down. Sometimes bacteria and other types of viruses can take advantage of a lower immune state. The most common types of infections are upper respiratory, but more serious ones beyond cold are also reported. Some individuals develop headaches, elevated blood pressure, and injection site reactions that are typically fairly mild. Your doctor will check for your liver function. In the beginning, blood work is usually done every 1 to 2 months for the first 6 months, and then about every 3 months once you're on treatment. Let your doctor know if you've ever had a history of hepatitis B, but your doctor will also check this in your labs because reactivation is possible on this medication if you've ever been exposed and had the infection resolve in your past. Tears in the intestine have also been reported, and it's important to let your doctor know if you have that history or a history of diverticulitis, which is inflammation in the colon. While very rare, multiple sclerosis has been diagnosed in patients on Actemra, and you should let your doctor know if that's part of your history. Allergic reactions are possible. Actemra is not thought to increase the risk of cancer in large studies, the largest of which included individuals taking Actemra with rheumatoid arthritis. But it's a theoretical concern because the immune system does play a role in cancer prevention or surveillance in the body. Low white blood cell counts called neutrophils are possible. Low platelets are possible. Those are the cells that help start blood clots, like in the skin when you get cuts. And then increased cholesterol is also possible, and your doctor should check that too. Pregnancy concerns in tocilizumab. It's also not known if Actemra can harm the unborn baby. You should talk to your doctor if you're pregnant or thinking of becoming pregnant when on Actemra. It can be transported as a protein across the placenta in the 3rd trimester. That could impact the infant's immune responses. If you are pregnant and you are taking Actemra, the company does encourage joining pregnancy registry to learn more. And breastfeeding is not recommended while taking Actemra. It should be a personalized decision with your doctor regarding taking Actemra or breastfeeding, but both are not recommended together. Effectiveness. So this is the trial I mentioned. Actemra was compared against placebo for about a year in 210 patients with scleroderma, and 136 had lung involvement. And the trial's primary intent was to look at change in skin thickness over time. And tocilizumab didn't impact skin thickness compared to taking the placebo pill. However, when looking in their subgroup about changes in lung function over time, they observed that Actemra, the individuals taking Actemra had lung stability compared to the individuals taking the placebo who did have more decline, which was statistically significant. And while this was a pre-specified planned analysis that the trial did, it's important to take these results with caution because this was a sub-analysis and was not the primary intent of the study, which was focused on skin thickening as their first outcome. So what should you tell your doctor before taking tocilizumab? So because it can increase your risk of infection, you should certainly let your doctor know if you think you have an infection or you're prone to infections. If you have a history of hepatitis B or tuberculosis, both of those can also be tested for. So if you don't know the answer, your doctor definitely can find out with lab works and will do so. If you have liver problems, let your doctor know. If you've had diverticulitis, like I mentioned, that inflammation in the colon that could increase the risk of perforation, definitely let your doctor know. Same with history of multiple sclerosis. If you've had a recent vaccine or scheduled to have a vaccine soon, let your doctor know. Certain types of vaccines that are live viruses should be avoided in patients taking medications that lower the immune system. Typically, Actemra is held prior to surgery. So if you have anything planned or you recently had surgery, both of those let your doctor know. Same if you're breastfeeding or you're planning to become pregnant or are pregnant, keep that line of communication open with your doctor. And finally, if you're taking any medications, again, including those non-prescription vitamins and herbals, those can make a difference in the medication and are important to discuss with your doctor. The FDA has a phone number and website. If you ever have side effects, you can take a look at that and learn more information. So I thank you for listening. And again, we'll take questions in the chat at the end. And for the second half of our program, I'd like to introduce Juliet Kleinman, our Senior Social Work Manager in the Department of Rheumatology, and Susan Rodriguez, our social worker in our department, who will discuss strategies to optimize patient access to medications. And
thank you, Dr. Showalter, and I'm going to share my screen now. Okay, and I hope you all can see that. So we are going to be talking about strategies to optimize patient access to newly approved medications, for which Dr. Showalter shared with us. And I just want to, okay, so you all can see, yes. Excellent. So for today, we'll be providing an overview of the authorization process of the 2 new medications that Dr. Showalter presented. And throughout our presentation, we will be providing tips and resources for obtaining these medications. And now I'd like to introduce Susan.
Thank you, Juliet. So, now we're going to talk about the medication authorization process, but before we actually get into the process, I just wanted to acknowledge that it may be challenging to manage your condition, and I just want to reassure you that your rheumatologist and their office staff, along with your insurance company and your pharmacy, they are all working together to help you get the care that you need. So once you and your doctor have decided what is the best treatment plan, you will begin the journey of obtaining the authorization for your medication. Obtaining the 2 new medications that Dr. Showalter just talked about is very different than filling your prescriptions for other medications that you were taking. And to follow, Juliet is going to present a brief overview of this process and some tips and strategies to help make this process more seamless for you.
Thanks, Susan. So as you can see with this image, this is the cycle of the prior authorization process, and we're going to be going through it in detail. So there are many steps that are taken to fill these specialty prescriptions. It's a process and can take some time from the moment the prescription is prescribed to being able to begin the medicine. There's a lot of behind the scenes work that goes into this process between your doctor, insurance company, and pharmacy in order to have it approved. So we are showing you this infographic to show you what happens behind the scenes. So as you can see, the first step is when the doctor sends the prescription through the computer to the pharmacy, and there's a lot of back and forth, and we're going to talk with you about the steps.
Thank you. So step number one, we just reviewed the prior authorization process in general, but for you as the patient, the first step of this process begins with your doctor selecting the specialty pharmacy that works with you, your insurance, and the medication. And once the prescription has been received by the pharmacy, then the process begins. Okay, next slide. So in step number two, I just want to highlight that this is one of the most important steps for you as the patient. As you can see, the most important steps are highlighted in red. So in step number two, the pharmacy will call you. They will confirm the date, the time, the location of the delivery for the first shipment. It's important that you give them the best phone number to reach you, because when they call you, they may appear as a toll-free number or a blocked number or unknown. And if you don't answer, they will leave a general message about your prescription. Make sure to pick up the call, or if they leave a message, make sure to call back. And I just want to highlight that many people may not feel comfortable with accepting calls that are blocked or unknown, and that's okay. Just make sure that you return the call. If your specialty pharmacy can't reach you after several attempts, unfortunately, your prescription will go on hold, or it can also be canceled.
Thanks, Susan. So step three, your prescription is shipped directly to your door. Make sure someone 18 or over can sign for the delivery, because if there isn't an adult, then it cannot be delivered. And the prescriptions cannot be left unattended or outside. After you receive your prescription, there will be follow-ups by phone from your pharmacy. And the specialty pharmacy may call several weeks after you start the medication to see how you're doing. And that's normal protocol. They will stay in regular touch with you to schedule refills and answer any questions that you may have. So patient prescription assistance programs. The specialty pharmacy will tell you how much the prescription costs. This may be a very high figure. Don't be alarmed by the amount. There are many programs to assist patients with these costs. Don't be afraid to say, I can't afford this, or this cost is too high. There are programs through the medication companies that can help you pay these costs. So again, many pharmaceutical companies have programs to help patients optimize obtaining prescribed medicines. These programs also offer support and guidance to patients. And in addition, many programs offer financial support to help you afford. Again, don't be afraid to ask about them.
So we wanted to share with you some of the patient assistance programs that are available to you for both of the medications. For OFEV, their patient support program is called Open Doors. You can visit their website at the link we've provided, and these slides will be emailed to you. Or you can call them. They have a 24/7 care team at the number here you see on the screen. If you have commercial insurance and you need help with co-pays, you can call their financial assistance, or you can click on the link. And for patients without insurance or who may have a lower income or a fixed income like seniors, there's also help for that as well. Okay. For the medication Actemra, their support program is called Access Solutions, and they work with you and your healthcare provider. They work with your insurance company and your specialty pharmacy to help you obtain your medication. And if you're eligible, there are options to help you pay, which may include their copay program. I noticed that somebody mentioned that they were on, I think it was OFEV, and they took advantage of the copay program. Referrals to independent copay assistance foundations if you don't qualify. and then the Genentech Patient Foundation as well. And there are different criteria, and if you don't meet a specific criteria for one of the foundations, you may meet it for the other. So it's important to know your options.
So we briefly gave you an overview of this process, and we want to let you know that obtaining these new medications can be extremely important and an important opportunity for you. And partnering with your doctor and their office staff can help to maximize this authorization process. It's important to stay informed by talking with your rheumatologist and with the trusted sources we have discussed today. And we really thank you for taking part in this webinar. We really would like you to ask questions in the chat box, and we're going to take some time to talk about that and answer your questions. And we also have some additional resources about the authorization process. There are links to these articles talking about what is a prior authorization, what do you need to do, an ultimate guide to prior authorization, and electronic prior authorization. So we just want to wrap up our part today and ask you to complete this anonymous program evaluation. We want to give you a minute or two to click on the link that's in the chat box that Elizabeth has put in the chat box. So we just want to take a few moments to have you give us your feedback about our talk today. And we really appreciate your comments and suggestions.